I had the opportunity to talk about several cases of CLL, which really highlights the challenges we have today in the management of relapsed and refractory disease. The first case really focused on a woman who had had multiple prior lines of therapy, but had a number of comorbidities, including hypertension, atrial fibrillation, on an anticoagulant. And the question was, what was the best way to manage this woman? We reviewed what the treatment options are. We reviewed the role of Ibrutinib based on the Resonate data. We reviewed the role of Idelalisib and Rituximab based on the 116 data. And for both, we actually extensively discussed the side effect profile of these drugs. And the reason is because for a practical decision, that's really where it comes down to for the choice of the treatment for this woman. Ibrutinib is a pretty well tolerated drug, but it is associated with a risk of hemorrhage, particularly in patients who are on antiplatelet drugs or anticoagulation. It's associated with a risk of atrial fibrillation. It's associated with a risk of hypertension. And she already came into treatment with these complications. So for her, the better choice was the selection of Idelalisib plus Rituximab. But that itself has its own toxicities, including a risk of transaminitis, which she actually did develop, but never developed a grade 3 transaminitis. So the drug was continued, and then she eventually developed a Idelalisib-associated colitis, and pathologically, this is a lymphocytic colitis. It's very steroid responsive. We managed her initially with inpatient corticosteroids, switched her to budesonide, and then after 2 weeks, the diarrhea resolved. She resumed treatment at a lower dose, 100 milligrams twice a day, and was able and I gave her prophylactic budesonide. There was a second case about the sequencing of these drugs, and the bottom line there is, if you have Idelalisib and you have Ibrutinib, can you use the same drug after progression? And unfortunately, the answer is if you're progressing, your response to the alternative kinase inhibitor is not very good. However, if you're intolerant of the first kinase inhibitor, so if you come off for toxicity for either Ibrutinib or Idelalisib, the alternative kinase inhibitor can be very effective. And so that helps us understand how to sequence these drugs.